Thank you and good afternoon. I thought it'd be helpful for us to give you an overview of the Abu Dhabi Biobank in terms of its structure and its mission. It's multifaceted, it's not just one purpose. So I'll invite my colleagues, starting with Dr. Mohamed as a representative of the DOH, to outline the vision for establishing the Biobank and its mission, particularly with respect to public health in Abu Dhabi.
First of all, thank you very much for inviting me again. So when it comes to the biobank, so the vision of the biobank was actually to collect the samples that we need within our environment or healthcare sector. So when it comes to public health, when it comes to programs such as, let's say, the premarital screening, we have the genetics samples, and we also, with the newborn screening, let's say, we have the cord blood samples, and with that, it's not only that we're going to implement these programs within, let's say, our healthcare system, but it will also enable us to research on the diseases that we have within the country. So it plays multiple roles, and also we can use that cord blood sample for treatment as well. So having that biobank is actually essential for most of our work in public health and within our healthcare system.
Thank you very much, Dr. Mohamed. Dr. Rachael, if you could just give an overview of the pan-human biobank, what does that actually mean, and where is it going, and what is its mission?
Thanks, Paul. So the pan-human biobank is really a terminology used to represent a collection of human samples from participants, and it's kind of multifaceted in itself. So there's three key elements to the pan-human bank. There's notionally healthy participants, those that don't know that they've got a disease or are healthy to start off with, and as the biobank progresses may develop diseases. There's a second sort of cohort, if you like, that we can follow longitudinally, so we can do repeat assessments of those individuals and measures of, take samples, physical measures, and really look at disease progression over time in those participants. And then there's the sort of the disease cohorts, if you like, really focusing and honing in on prevalent diseases within the UAE. So for like example, we're planning on collecting 10,000 oncology samples, which will provide a vital resource for cancer research and facilitate accelerated clinical trials in those areas. And that's really key. And the idea is you collect these samples from these individuals, you link that to their health medical records and other data assets as well. So we've heard a little bit earlier on about how important the environment plays as well as genetics. And that's really key here, and that's a unique proposition that we have in the UAE. We're very fortunate that we collect a lot of data about the environment that we live in and also lifestyle as well, and the impact that has with our genetics in terms of disease progression. And that can be really useful. It can provide a drug discovery tool for clinical trials, new drug targets, identification of new biomarkers as well. So,
thank you, Dr. Rachael. I'll just link that back to some comments that Dr. Mohamed made around lifestyle and genetics. And I'm aware there's been a lot of discussion today about the EGP and how it's plugged the hole in the underrepresentation of genetic research in the region, and that's a wonderful thing. And there's been a snapshot in terms of methylation and epigenetics. And as we know, lifestyle and environment have an influence on methylation and epigenetics. So in an ideal world, how would we capitalize on this synergy between the biobank capturing this lifestyle and environmental information and a longitudinal follow-up on these epigenetic individuals?
So basically, because we have these samples that we collect as a pan-human, then we can look at let's say, the patterns that are changing within the methylome. So, and that's what we want to know, is like what affects what kind of CPGs, let's say, that are turning off and on these genes. So having these samples in let's say, in different time zones or timelines would give us that kind of visual on what patterns are let's say, becoming different in a way or changing, that will let us lead from a research perspective on how is the environment actually affecting our genome. And usually when it comes to epigenetics or methylome, it's regional. So what changes our methylome here could be different than what changes the methylome in the UK or let's say in the States. So it would be really interesting to see that pattern change within.
We
different
seem to be uniquely placed to link that methylome data with environment and lifestyle, what's known as the exposome, really.
Exactly.
And that is the passive environment that you live in, the air that you breathe, the water that you drink, as well as the choices that you make in your life or have made for you. So whether you exercise, whether you smoke, and your occupation. And the biobank will act as an aggregator and bring all of that together into a cohesive data source. And that's where the role of the TRE, Trusted Researcher Environment, would come into play, facilitating AA mining of that data. So maybe just a few comments on the TRE.
Exactly. So with the TRE, if you have the methylome or the multi-omics with the environmental effects and with the genome, with the phenotypic data, having all that data set in one place for each patient or each participant, will give us so much insight on these, on how can we, let's say, change those people's lives into a healthier, longer life.
Detect and intervene earlier.
Yes.
Thank you. And Dr. Hatim, please, if you could just introduce the cord blood and tissue transplant component of the Abu Dhabi Biobank.
Yeah, okay. Cord blood, as we know, it's remaining blood in the umbilical cord after delivery of the baby, which is they found it's the richest source or resource of stem cell, which is fortunately it can be used for the treatment of a lot of diseases, more than the 80 diseases. One of the most important of them is the thalassemia, leukemias, and another blood disorders, which can be used for transplant. And why we are telling transplant? Because we know that the HLA barrier is the most and the very dangerous barrier in the transplant, which is the give the advantage of using cord blood in stem cell transplant. Even there is some disadvantage with the low stem cell, but now with the new methodology, the people are covering this by doing expansion and doing a lot of techniques and doing the double transplant methodology. So this is in the matter of transplant. So the cord blood bank play a very vital role, I believe, in bridging the gap between the innovative medicine and the real practice medicine, where you need to treat people with real medicine, and at the same time you used to use the innovative medicine in a matter of precision medicine, in a matter of technology, in a matter of having a very good platform for doing research in a different type of cord blood cells. We are not talking about hematopoietic stem cells alone, because we know well hematopoietic stem cells, it's giving its success rate in the transplant, but we are talking about mesenchymal stem cell, which is in the cord tissue, where we isolate this tissue, which are going to be treated a lot of regenerative diseases or doing regenerative medicine, and there is a lot of success rate in this. And now, if some still under research, but it's very promising materials to be used in a matter of research. Yeah.
Thank you, Dr. Hatim. A question for Dr. Mohamed again, just coming back to the EGP, and really how the USPs of the Abu Dhabi Biobank and its potential to trump others. I'm conscious that within the EGP we can map the genealogy, we can map the families and the disease burden within families, which is, to my knowledge, is not something we can do in UK Biobank, Dr. Rachael. No, which presents a huge advantage.
Exactly. So we were lucky enough to do it in a different way, let's say, than the biobank, where the biobank was most like the UK biobank was pre-selected. For us, it's like everyone and then select. So it's the other way around in a way, and this allowed us to do way much more than the UK biobank. And I'm not saying the UK biobank is not good. They have an amazing biobank. It's just that in ours we made it in a way that you gather all the samples first and then segregate them based on, let's say, the phenotypic data that we have. So we are able to, let's say, mix and match whenever we want and however we want.
Yeah.
So that kind of gives us the advantage there.
Another significant advantage is in the way that the Abu Dhabi Biobank has been constructed and the consent, it will allow us to recall participants to take part in studies, obtain further information which is pertinent to them. So essentially facilitating precision trials, whereas the UK Biobank is observational and is just waiting for people to develop disease. Dr. Rachael, I don't know if you want to comment further on that.
I think that's really a key differentiator for us here. We're creating, and we've got a fantastic resource as well with EGP, and what we're developing now with Abu Dhabi Biobank really is a value proposition for the UAE, having that ability from a well-characterized sample set and, all the way from genotype to phenotype, and the ability to recontact those individuals and say, actually, we're doing a clinical trial on X, so we want to look at this further. Would you be willing to participate is key. And I think that's one thing that will set us apart from other biobanks globally.
And something I just wanted to make note of, and it's been referred to during the course of the last 3 days, are the various stakeholder groups and the importance of those in terms of the physicians, the clinical facilities. But I want to acknowledge actually the 800,000 Emirati people have chosen to take part in this participatory research and essentially donate their blueprint for the medical good. If we contrast that to the UK Biobank, the uptake rate there was 3.7%. So it really is an important success factor that almost the entire population are willing to get behind biomedical research, which is in the greater good. Dr. Hatim, I'm conscious that there are other work streams within your sector that are addressing other unmet needs in Abu Dhabi and the UAE with respect to fertility for patients undergoing chemotherapy, radiotherapy. Maybe you could talk a little bit about that.
Yeah. Now we are in Abu Dhabi Biobank. We are developing the service of cryopreservation of testicular tissue and ovarian tissue, where it's a new methodology maybe to save the life for the people who are they will go for chemotherapy. So we are saving their testicular tissue at the early stage before they going for this regimen of chemotherapy, and for the ovarian tissue as well. So this is again, it's one of the vision of the Abu Dhabi Biobank, just to make life of the people very easy and very comfortable.
Thank you. And as with any endeavour, we've got to demonstrate a return on the investment. The DOH has made a major investment in establishing the Abu Dhabi Biobank, and I think we can characterise that into short-term, medium-term and long-term goals with a double bottom line. So, for instance, Dr. Hatim, you're establishing a stem cell registry, which is well matched to the local population genetically, and can be used to treat in excess of 80 life-threatening conditions?
Yeah, exactly. As we said earlier, the problem is always the HLA match and the representation of each country among the whole registry. We know that our area is a little bit not representative in a good way to find donors because of the ethnic groups and all these things. So the establishing of public biobank and a good inventory pool for core blood unit, will help expanding the pool of the HLA, so you can solve easily the problem of lacking of match donor.
Yeah.
So this is the main purpose of building this type of banks. Yeah.
The crucible would be the first transplant that we could facilitate for a patient and a donor that resides within Abu Dhabi and the UAE. Can you kind of quantify how far that is out in time, or how close are we to being able to serve that need?
We are close to that. Just it's a matter of we're having now a good number of samples, and in a matter of HLA typing, since the matching rate according to the literature is around 75% to get a match between the siblings and between the community. So it's easy to get, if you have a good pool of samples, it's easy to make this transplant inside the country rather than send the patient, especially with the people who doesn't have a donor. They don't have a potential donor. So the only solution is unrelated donor. So unrelated donor, either you will go to unrelated living donor, whereas there is a lot of obstacles in this to find a donor with the same ethnic group, and to find a donor who's ready to transplant till the end of the point. The public banking will solve this because it will be like you have a donor on your shelf. So, so the sample is ready, HLA match, will screen, no viral infection, and with a good quality of high dose of stem cells. So you can facilitate the transplant inside the country and this one.
Thank you. Thank you. And perhaps a medium-term goal, Dr. Rachael, was to foster partnerships with biopharma and leading academic institutions around the world that can capitalize on the information that we've assimilated and translate that into new inventions, patient benefit. How do you see that? How do you see that progressing?
Yeah, I think that's really key for us, and it's an opportune moment at now, really. We're designing the protocol still, it's not finalised. So we're really keen to engage with pharma, engage with biotech, engage with tech companies as well, and bring them on board and say, what do you need to accelerate clinical trials in the UAE here? You know, we've got a unique population here that's underrepresented worldwide. Let's capitalise on that and really make sure what we're doing is delivering a health benefit for everyone in the UAE and globally.
Yeah, thank you. And Dr. Mohamed?
So I just want to highlight something that you mentioned is that the high uptake, so with 800,000, let's say, that kind of puts pressure on us of trust. People trust us.
Indeed.
And that's why they came. So we need to make sure that we don't break that trust. And in order to do that, we need to have programs such as programs that Dr. Rachael and Dr. Hatim was mentioning, that making sure that the individual is benefiting from this program before the society. And of course, the society needs to benefit from it, but the individual themselves. And that's how we build the trust. That's how we keep the trust, especially even with collecting samples for the biobank. If they trust us enough to say that they'll benefit from it, they will come to us. So I think that's a very important thing that we need to mention and highlight.
I think you make a very important point there, and building awareness and informing the general population of the purpose of the biobank and biomedical research, at large, and setting expectation as well. I think in terms of what it can return, perhaps for them, but that may be limited. It may not, but certainly this is a long-term objective that will have health benefits for future generations, and I suppose that's the long-term mission, and inform public health policy.
Exactly, and seeing the accomplishments that we have, that we've seen, and we will see. Hopefully, this will let's say put us at ease a bit when it comes to the trust. But we're always, let's say, they always put us on our toes. Sorry, just to make sure that we're coming with the most advanced, let's say, technologies when it comes to biobanking research on the samples that we have, using it for treatment, as Dr. Hatim was mentioning, and using it for anything that would benefit them, let's say, in healthcare.
I agree. It's paramount that the donors are confident that their information is highly secure and protected, and is only being,
as well. Exactly.
Yeah, and only being used for approved research by bona fide researchers. And to communicate that to the wider audience. Dr. Hatim, beyond therapeutic use, the stem cell registry, the stem cell resource that we're building has a research potential, and there's increasing interest in stem cells beyond therapeutic treatment.
Yeah, as we said, the beyond the transplant and the therapeutic use, you can use the public banking samples as research. And what make it very, very precious resource, because it will cover all the unethical problems in the research or the ethical problem of the research, because this is coming from a healthy donor who's consented, informed consent to use his sample for research, and you have a good quality of stem cells or hematopoietic stem cell, mesenchymal stem cells, whatever cells you need for the research. So the pharmaceutical company can use it for different type of research with no barriers in a matter of infectious diseases or in a matter of in consented samples. And this is one of the problem of the research. And it can be let us say, suitable change or suitable things. People are using embryogenic cells, embryo cells, which is unethical and in a matter of religious and in a matter of ethical things. So the cord blood, it can represent that one. So for the different type of therapeutic research which pharmaceutical company use it. Yeah.
Okay, thank you, Dr. Hatim. Dr. Rachael, you touched on the three different cohorts, focus on oncology, the chronic diseases that are of greatest burden, and then this concept of a healthy cohort that you follow longitudinally. That in itself is a big endeavour to do it at scale. What are your thoughts on how that might be achieved in the UAE, Abu Dhabi context?
Yeah, sure. It's something that other biobanks have struggled with, actually, because operationally it's quite a challenge to do and to get people back in.
I know.
Yeah, we're talking about from UK Biobanks experience in particular, but here I think we, again, have a unique opportunity in the UAE. We've got very well-established public health programs in place. People regularly and routinely go in for part of screeners of those programs. And I think that in itself is very valuable. That gives us the ability to, people are used to going in for these screening programs at regular intervals, to really go to those individuals and say, we're collecting for the biobank, would you be willing to come back at set intervals and do what we would call repeat measures? So that's, you take similar samples again from those individuals, you collect maybe physical measure data, and what that creates is sort of a timeline of health for that individual from someone who may start at the start of the collection be healthy, and then by the time you've done repeat measures may have developed diabetes or cardiovascular disease or something. It really enables you to look at changes in that individual, and that is really the value in biobanking, really.
And just to complement that as well is the study of early life. So, with the concept of a birth cohort and following essentially individuals from point of birth and how early life, family life influences later health outcomes. The UK Biobank's earliest intake was 45.
Yeah.
So you've lost that ability to understand in detail how early life exposures influenced later life health outcomes. Dr. Mohamed, I don't know if you want to comment.
It's exactly what we were mentioning at the beginning, is that if we want to study, let's say, the methylome or the epigenetics, having this timeline would actually benefits us and would give us that unique advantage on these types of research. So I know longevity is a big thing. I'm looking at the time. Right? I know longevity is a big thing, but here, so this is something that we can study on using the biobank.
Yeah, indeed. So lots of opportunity. Thank you. Thank you. I'm conscious that we've used our allocated slot. If there are any quick questions.
Thank you so much, everyone, for an interesting talk. I'm Sumrita, and I am from Canada. And what interested me here is I'm myself a biomedical scientist, so I was listening to Dr. Hatim. I just have a quick question on application of stem cells, whether it be mesenchymal stem cells or any stem cells from any part of the body. Maybe I missed some part of the discussion. Are there case studies, real-life case studies, where you have actually used stem cell for some kind of a treatment and then followed it up? Because we understand that maybe there might be complications down the patient's recovery journey. Any kind of a real-life case scenarios or case studies that you would have done in your hospital where you have seen success of stem cells during the process and over the period of recovery of a patient? Thank you.
Okay, as Abu Dhabi Biobank is still established before 1 year, 1.5 years, so we didn't do any clinical study yet, but we have been exposed this previously in one of the patients, and they did, for example, actually in another country, they did for them mesenchymal stem cell, and we have following up with them in the team, and the success rate was very, very high and very promising. Despite that, still in some countries, this kind of medicine or of treatment, I will not say not legalized, but not approved as per the best evidence medicine used in certain country. But there is nothing to do with this trials if it's agrees as per the country. So we have Asian countries, they doing some tests, and according to their rules, it's approved and it's scientifically approved, and they have a good result in that one. Yeah.
Thank you. I think we're officially out of time, so thank you, everybody. Thank you to my panelists.